Hello everyone. Today we are going to explore an essential topic in pharmacology and oncology, the principles of malignancy and its treatment. In this session, you will have a detailed go through regarding the pathophysiology of cancer and the drugs used to fight against cancer. So let's move towards its introduction. So, cancer is a disease which nowadays almost is very common amongst the population. So, as per the report of WHO, in 2022, almost 20 million cases were registered which were having cancer. And from this 20 million people, almost 9.7 million people were found to be dead because of the leading cause, that is cancer. So, what is this cancer all about? So, cancer is a condition which develops inside a human, which is because of excessive cell growth of the human cells, which are also termed as the host cells, or you can say the own human cells. Throughout the slides, you will be coming across the word that is host cell. So, host cell means the normal human cells. So if there is any abnormality, or you can say any mutation in the normal host cell, so because of that genetic mutation, or you can say immune responses, the result comes is cancerous tumor, because of which it increases the replication of cells very fast. So, if we defined cancer, so cancer is a disease characterized by uncontrolled growth and spread of abnormal cells inside the body. It occurs when genetic mutation disrupt the normal regulatory mechanism that controls the cell division, leading to excessive cell proliferation, and in some cases, the ability to invade nearby tissues and spread to other parts of the body. That means if the growth of the tumor is very fast and the size is very much big, so there are chances that it can affect the adjacent organs, and this process where from one organ to other organ the infection spreads, that we termed as metastasis process. And when we talk about the cellular proliferation, the cancerous cells multiply faster than the host cell, and therefore they are capable enough to develop tumors. Unlike microbes, these are not a microbial infection, fungal infection, or bacterial infection. This infection is caused, or you can say this disease condition arise because of genetic mutation which occurs in the host cell, which increases the cell proliferation. Cell proliferation is nothing but cell replication, where the cell replicates very much faster. Now, therefore, it is very difficult for anti-cancer agents. Anti-cancer agent means the drugs which we use for the treatment of cancer. So that is termed as anti-cancer agents. So anti-cancer agents or anti-cancer drugs, the most important problem for them is they cannot differentiate between the cancerous cell and the host cell. As we have discussed prior only, they are the normal human cells only, which are growing very much faster. So for the medication, it is very difficult to differentiate between them. If we talk about like bacterial infection, so the bacterial genome is different and the human genome is different. So at that time, it becomes very much easy for a chemotherapeutic drug, that is bacteriostatic or CIDL, to invade that bacteria and provides its therapeutic action. But whereas as the host cells are only damaged, so for such damaged condition, it becomes very much difficult for anti-cancer agents to differentiate between the two cells and to find the cure. And because of this, we have associated adverse reactions of chemotherapeutic agents, which we all know the most commonest adverse reaction is baldness, where the whole body hairs are removed off. And by the appearance only, we get to know that this person is or may be subjected to any chemotherapeutic radiations, or you can say any chemotherapeutic medications which has induced a temporary allopathic condition. Temporary allopathic means it is not a permanent type of alopecia. Once the treatment is over, the hair follicles will regenerate and the hairs will regrow. Okay, so additionally, if we talk about the cancer, so what happens in cancer? There are, if you recall the cell cycles, or you can say the phases of cell division, so there is one most important phase which is termed as resting phase of cell, where after multiplication, the cell rests for a particular period of time. During that resting phase, the cell gets mature and gets ready to divide further. So during this, you can say cancerous cell replication, this resting phase is very much less, or sometimes it is so small that we can neglect this resting phase also. And because of this negligency, or you can say this lesser time in resting phase, the cancerous condition may arise in a normal, healthy human being. So, what is the exact pathophysiology behind cancer? Let's understand. So, if we talk about the normal phase of cell cycle, because it is, if you define cancer, it is the host cell which gets damaged. So, normal cell cycle will be there. In that cell cycle, there will be abnormalities which leads to tumor-like condition. So, if we talk about the normal phases of cycle, first most important phase is DNA replication, where the genetic material gets replicated, okay, for any cells to get divided. So if there is replication of the genetic material, then what will happen? The nuclear membrane will divide and two nucleus will be separated. From, as the two nucleus separates, it sends the message to the cell membrane, and when the cell membrane gets activated, it divides the cell into two. And for that, we have different phases. Like if we talk about meiotic cell division, we have different phases. So the first most important phase, that is interphase, where the cell prepare its cells for division. The next phase is a mitotic phase, or you can say mitosis. In mitosis also, we have four different phases. You must be aware about that four different phases. That is anaphase, prophase, metaphase, anaphase, and telophase. So from that, again, it is going to enter G0 phase, that is resting phase, where the cell will be in its resting condition. No replication process will take place. The cell will be maturing itself and will prepare itself for interphase. So in cell of cancers, or you can say the cancerous condition, this G0 phase is reduced. At the same time, there is very small span given for this G0 phase, because of which they proliferate very fast and develop a tumor-like condition. So just for a revision, so what happens is G1 is your growth phase, then S phase, that is DNA synthesis phase, then G2 phase, that is second growth phase, after which the cell will undergo meiosis and then cytokinesis. Cytokinesis means the division of cell membrane. Cytokinesis is the process where the cell membrane gets divided and you have a two daughter cells. So that is your cytokinesis process. Okay, so after that, what happens in cell cancer progression? So cancer develops due to uncontrolled growth of cells and divides very fast because of genetic mutation. Genetic mutation means there will be change in several genomes, okay, that are responsible for the growth. If there are growth factors which get you can say activated, because of that growth factor, ultimately there is you can say cell division, which leads to cancer like condition. So the known pathophysiology, or you can say the known key points for the occurrence of cancer, is first genetic alteration, where the cell gets continuous message for replication. Because if genetic alteration is not there, then DNA will not replicate that fast. So if DNA is not replicating fast, there is no chances the cell will replicate. For replication, the first most important step required is replication of genetic material. And that for human cells, it is DNA. So if replication of DNA is there, then ultimately cell replication will be there. So that alteration is what we are talking about. Then second is tumor formation. So if there is excessive cell growth, then ultimately it is going to do what? That is formation of tumor. Okay, then invasion. Invasion means passing from one organ to other organ. There are chances, like if somebody is affected by pancreatic cancer, okay, it is the most difficult cancer to treat, but as the size of pancreas is very much small, so if it is having a full performed tumor growth, so there are chances that it may affect the adjacent organs near the pancreas. That is invasion. From one organ it starts entering the next organ. And then second is metastasis, that from one organ it has invaded the other organ, and here also it is proliferating very much fast. That is metastasis process. Next, which are the different stages of cancer? So till now we have a TNM system through which we can classify the stages of cancer. Normally we know that everybody is aware that there is stage 1, stage 2, stage 3, stage 4 cancer. Now what are the stages? These stages will actually tell you what is the size of tumor, nodes, and what is the level of metastasis. Size of tumor means till what extent the tumor has developed. It is in the starting stage, it is in the middle stage, or it has extended its growth throughout the organ. So that is TNM system through which we you can say classify the cancer into 5 main stages: 0 stage, 1 stage, 2 stage, 3 stage, 4 stage. So these are the 5 stages. 0 here doesn't mean that it is absent. 0 means just proliferation starting. Okay, mild nodular tumor. Nodular tumor means node-sized tumors. A very small perfusion or a very small, you can say, circular structure which develops. That is your 0 phase. In further slides, with the help of image also, we are going to understand the same. But based on these three, we will we will name the cancer. At the same time, why nodes are so important? Because if there is an abnormal condition in any organ, the nodes get activated. And if the node gets activated again, if it is there in lymphatic system, so what happens is it is going to proliferate very fast. Okay, because our immune system, or you can say our lymphatic system, is again a type of, you can say, circulatory system. So based on these three things, we define the stages of cancer. So as demonstrated in the image, first that is 0 phase, where I told you that it is a very small dot-like structure. So that is 0 stage. Then second stage 1, you will be seeing that the size has increased. Second stage, again the size has increased. Third stage, it has increased. And in fourth stage, the whole stratum of the organ has been affected. And after this fourth stage, invasion and metastasis can occur. Invasion means it can affect the other organs also. Okay. So now I hope you all are clear with the pathophysiology of cancer, that how it occurs and how we label, or you can say how we classify them into different stages. There are different methods also to diagnose. So first we are, which is very common, that is biopsy of the tissue, taking the samples from the tissue and identifying them based on histopathological evaluation, and to know what is the extent of cancer. Then second, there are genetic tests. Just a Her test for breast is very common, because nowadays breast cancer is very common in the females. Okay, so that genetic modifications or genetic alteration tests are required depending upon which side it has been affected. And then we can come to a conclusion that which is the type. And based on that type, we can select the chemotherapeutic agents. So let's understand which are the different drugs which we use for the treatment of cancer. So if we see the classification, there are mainly 3 classes which is used for the treatment of cancer. First, that is cytotoxic drugs, target specific drugs, and hormonal drugs. So what are cytotoxic drugs? So cytotoxic drugs are the drugs which is used for the treatment of cancer. But the disadvantage of the cytotoxic drugs is they cannot differentiate between the host cell and the cancerous cell. Okay, these drugs will affect both cell, normal cell as well as abnormal cell. That is the only difference between cytotoxic and target drugs. Target drugs are a specially modified drugs, because as we know that there is genetic alteration or there is change in the signaling pathway of the cell. So we target that signaling pathway, and based on that target, the target acting drugs are there. Okay, and the last one, that is hormonal drugs. Mainly these hormonal drugs, or you can say hormonal therapies, are used for the cancerous condition which are there in glands. Like if there is a cancer in thyroid hormone, adrenal gland, or you can say not adrenal gland, growth gland. So if the glands are affected because of cancer, or you can say during the cancer treatment, so along with the anti-cancer drugs, we prescribe several hormonal supplements also. Okay, or if you say if the cause of the cancer is because of under or over secretion of hormone, so at that time also we use the hormonal drugs for the treatment of cancer. So this is a classification of cytotoxic drugs. So first, the cytotoxic drugs are classified into alkylating agents. In alkylating agents, again it is classified into nitrogen mustard, nitrogen mustard, nitrosourea, alkyl sulfonate, triazines, and methyl hydrazines. Ethenamines also. Then the next class, main class, is platinum coordinating complexes. And third most important class, that is antimetabolite drugs. In antimetabolite, it is furthermost classified into folate antagonist, purine antagonist, and pyrimidine antagonist. So this is just an classification of cytotoxic drugs. Further also we have different classes. So further, and cytotoxic drugs are microtubule damaging agents. Microtubule damaging agents will target the microtubules which is developed during the spindle formation. In microtubule, you can say damaging agents, vinca alkaloids are most common, and toxins. Then next is topoisomerase 2 inhibitors, topoisomerase 1 inhibitors, antibiotics, and miscellaneous drugs which we use for the treatment of cancer. And this cytotoxic drugs, again I'm repeating, is they cannot differentiate between the normal cells and the cancerous cells, and therefore they have associated adverse reaction on the organ also. They will damage the healthy normal cells also. Okay. Then next is targeted drugs. So in targeted drug, first most important class is tyrosine protein kinase inhibitor, EGFR inhibitors, angiogenesis inhibitors, proteasomes inhibitors, and monoclonal antibodies. And in hormonal, it is glucocorticoids, estrogen, SEMRS, SER down regulators, then aromatase inhibitors, anti-androgenase inhibitors, 5-alpha reductase inhibitors, GnRH analogs, and progestins. So these are anti-hormonal drugs. So moving ahead towards psychotoxic drugs. So alkylating agent. So what is the mechanism of alkylating agent? So alkylating agents are the agents which increases or which produces carbonium ions. Now these carbonium ions are positively charged, as we all know. So what it does is it is going to react during the, you can say, activation. For DNA replication, there is a most important process, that is transfer of alkyl group from, you can say, the sequence. If you see the DNA arrangement sequence, so from there, for covalent bonding, that is for it, most important process is transfer or substitution of alkyl group. It needs to be substituted. Then only the cross-linking DNA strands will be generated. So what this carbonium ion does, it stops this particular alkylation process. Alkylation process is what? Transferring or substitution of alkyl group. So if this process is inhibited, the cross-linking between the two DNA strands will not take place. And if this cross-linking is not there, ultimately the DNA synthesis will be inhibited. And as the DNA synthesis is inhibited, what will happen? No replication of genetic material. No replication of genetic material means no tumor development. No cell proliferation or cellular growth will be there. As in the previous topic only, we have discussed that for development of cancer, the most important part is what? That is development of, you can say, or replication of genetic material. Here what we are doing is we are inhibiting the replication of genetic material by inhibiting which process? Alkylation process. I hope you all are clear with this. Next is anti-metabolite agents. Okay, so anti-metabolite agents, these are the agents which inhibits the synthesis of metabolites. Metabolites are your purine, pyrimidine, adenosine, guanine, cytosine, thymine, the base pairs which are there in the DNA, they are termed as metabolites. So what anti-metabolite drug does is it inhibits, or you can say it does not allow substitution of, you can say, metabolites. So if the metabolites are not, you can say, substituted, or if you can say in the sequence, if they are not placed properly, ultimately what will happen? A damaged coil will be generated. We all know that A needs to bind with T, C needs to bind with G, that is adenine needs to bind with thymine. So if this linking is not proper, a damaged DNA will be generated. That damaged DNA is not capable to induce cellular replication process. That is, it is not going to undergo transcription and translation. So if transcription and translation is not there, protein synthesis will not be there. If protein synthesis is not there, cell replication will be inhibited. Ultimately, the tumor size will come in control. Okay. Next is our platinum coordination complexes. So again, platinum coordination complexes, platinum itself is a type of ion, a positive charge ion. So the most important drug, always remember, platinum coordinating complexes, in that we use cisplatin more. It is the most common drug. So what the cisplatin does is it enters the cell, it dissociates chlorine. It will increase, it will remove chlorine ions. And because of that, what will happen? Positive charge inside the cell will increase. Chlorine, if it is out coming out, or if it is neutralizing, the concentration of platinum will increase inside the cell. And because of this increased concentration of platinum, platinum itself is a reactive compound, so it will interact with the DNA. And when it interacts with the DNA, it damages the N7 and O6 molecules, the guanine molecules, which is present at N7 and O6 position, that is been removed off. And because of this removal, the location, or you can say denaturation of DNA takes place. And as the genetic material is lost, the cell will lose its importance and cell death will be there. So ultimately what happens is the size reduction of the tumor will take place. Next is microtubule damaging agent. The most important part over here is understanding the concept of microtubules. Now, these microtubules, they are liberated during the process of spindle formation. Once there are two DNAs, or you can say two nucleus inside the cell, so that will be attached from cell membrane from the two microtubules, spindle fibers, and they will be pulled apart from each other. So this tubules, what are their physiological importance in normal cells is it induces morphological change inside the cell. Like we have different cells responsible for different functions. So it is because of tubulin presence. Next is spindle fiber formation, as we have discussed now only. Then kinase activation. Kinase activation is the charge activation. Mainly in kinase activity of cell, the phosphate group, or you can say phosphate ion, plays the most important role. That is transfer of phosphate group from one molecule to the other molecule, that imparts energy from one side to other side. That is termed as kinase activity of the cell. At the same time, gene transcription means to synthesize a genetic material which is required depending upon the prior data. So that is your gene transcription process, and you can say DNA interactions, that means normal interactions, or you can say normal activity of cells. Ultimately, if this all processes, if tuberculin is affected, that means all processes will be affected, and if the processes are affected, it is going to lead to, you can say, most important phenomena of our normal physiology, that is apoptosis and necrosis. Apoptosis is programmed cell death and necrosis is damaged cell death, which develops necrotic tissues. Okay, sometimes gangrene like condition. Okay, so depending upon the damage, we have to understand that whether it will induce necrosis or you can say apoptosis. Then next classes, uh, topoisomerase 1 and topoisomerase 2 inhibitors. So before going to the topoisomerase inhibitors, what is topoisomerase? Topoisomerase is the coiling structure. Topoisomerase is the structure which binds the DNA. Okay, we all know that it is a double helical structure. So if the double helical structure is there, so there are chances that it may open. So to keep that double helical structure intact, or you can say to keep it in the rounded structure, topoisomerase bind with it. Here it is written the scaffold type of structure. You can say ATPase domain, that particular structure, that is termed as topoisomerase structure. So the main function of it is to hold the DNA strands. Okay. So if the process of replication is there. So in process of replication, what happens is topoisomerase needs to get detached from the DNA. If it is detaching, then only helicase will come and will break the strands into two. So normally there are there are n numbers of topoisomerase, but for replication process, the most important is topoisomerase 1 and topoisomerase 2. What it does, it holds the DNA intact at the same time for the replication process. Means normal coiling also it does, super coiling it also it does, and it holds the coiling along with each other. Okay, so before replication process, the topoisomerase will detach, the helicase enzyme will come and will break the DNA strands into two parent DNA strands so that it can form new complementary DNA daughter strands. If the topoisomerase is not detached, then what will happen? If the topoisomerase is not detached, helicase will not be able to come and bind with the DNAs. Ultimately, what will happen is the replication of DNA will not take place. So therefore, topoisomerase also becomes the most important target for, you can say, treatment of cancer. So what we do is we inhibit topoisomerase 1 and 2 detachment from the DNA. Ultimately, no detachment, no replication. No replication, no division. So the tumor will be in control. Okay. So I hope you all are clear with what are cytotoxic drugs. Thank you.